Hello class, this is Kelly Neal again, and now we are going to be learning about the person's rights. We are going to be starting the California Department of Public Health Module 2, which is the residents' rights. And this chapter is going to correspond with Chapter 2 in your book and Chapter 5, and we'll be talking about some videos as well that will be showing you to cover all the content necessary. So when we're looking at the residents' rights, and again, we refer to someone as a resident when they are in a nursing home. We refer to them as a client when we're doing home care, and a patient usually when we're in the hospital. And almost every place you go to, a hospital, a nursing home, every facility has its rights listed for the patient, and they're usually posted somewhere for them, or they're actually given a copy of them. So we are going to be looking at our patients' rights. Now, the American Hospital Association, so if we were a CNA in a hospital setting, the American Hospital Association says you have the right to high quality care. You should be able to expect that. If you went to the hospital to get a procedure done, you would expect someone to give you good quality care. You would expect them to know what they were doing. You would expect a clean, safe environment. You should not be getting an illness because you're there at the facility. So you would expect that, yes, if you're sick, they're going to take care of it, but you would not expect to get sick while you're at the facility. And that involves we'll be talking a lot in a later class about infection control practices, and our infection control practices are very important, and a clean, safe environment for our patients is extremely important. People have the right to be involved in their care. So if you went to the hospital, you would be able to make choices about what treatments, what procedures you wanted to have done, what you didn't want to have done. Protection of privacy. Now we'll be looking at a video about confidentiality. We'll be talking a lot as we go through this class about protecting patient's information correctly, making sure we're safeguarding it, and we'll talk about that in this class and in future classes. Patients have the right to be prepared for discharge. So if you're going into a hospital and they're going to send you home in 2 days, do you know what's expected or what to expect when you get home? When you need to see the doctor, what medications you need to take, what's going to happen. So you need to be prepared for that. And patients also have the right to have help filling out their insurance claims to get reimbursement. Now, in a nursing home, again, we have residents' rights. Now, OBRA, the Omnibus Reconciliation Act of 1987, we talked some about that in our last module when we did our introduction into what a CNA does. And we talked about how it's a federal law and it applies to nursing homes in all states. So this OBRA does not apply in the hospital. Okay, they are governed by another agency, but the Omnibus Reconciliation Act, federal law, all nursing homes for all 50 states, and it says residents have rights. Okay, they have rights and we have to help meet them for them. And some of their rights is they must be informed. So on admission, a resident has to be told what their rights are, and they're going to be given it to them in print and large text print if that's what's needed, and they have to sign that they received it. And if the resident can't do that themselves, then their primary guardian or caregiver would get a copy of those and sign that they've actually received them. They have the right to have interpreters to be used if they speak another language. And ideally, we try not to use interpreters. We try not to use the family to interpret because they may not be familiar with medical terms or they may not explain something exactly correct. So it's not that we can't use a family in a pinch, but generally interpreters, we actually have to provide an official interpreter for the person. We need to avoid medical terms. And I know we're going to be learning a lot of medical terms in this class. We're going to be learning some medical this isn't a medical terminology class, but we're going to learn medical terminology as we go through it. And it's really unusual that I'm going to tell you, okay, you have to learn what these terms are, but then don't use them when you're with your patient. So it's like, why do I need to use them? Unfortunately, with your nurses, when you discuss things with nurses or later on when you go on for your nursing career and you discuss things with physicians, you'll be spoken to and speak to them in medical terms. But to our patients, we need to use the most common terminology that they can understand. And I already mentioned large print text has to be made available to them if that's what's necessary. So some of our residents' rights: information. A person has the right to be informed. If you went into a hospital or you went into a nursing home to stay, you would want to know what's happening, what the plan is, what the potential outcomes are, what all the expectations are. You have the right to have information, to stay informed of what's happening to you and of the care that you're going to be getting. You have the right to refuse treatment. Now, we need to discuss this a little bit as far as the right to refuse treatment. We will be talking in a little bit later about dementia, about taking care of a patient who has dementia. Dementia means that a person has loss of cognitive function. And what we mean by cognitive function is they have the ability, you have cognitive function, you have the ability to think and rationalize and use judgment. You have the ability to understand what's happening to you, and if you don't do something, what the potential consequences are going to be. You have the right to, you can memorize things, you have good memory. That's your cognitive function. So when somebody has dementia, they've lost the ability to rationalize or to use good judgment or to understand consequences. Their memory may be gone. And so a person has the right to refuse treatment if they have cognitive function. So let's say you have a patient in the nursing home and they're refusing to get cleaned up. If they understand that, if I don't get cleaned up, they're going to be more prone to infection, more prone to bed sores, more prone to skin breakdowns. If they understand that and they're still refusing that care, but they have cognitive function, then they have the right to refuse. But if you are taking care of a patient with dementia and they don't have that ability to understand, and they don't understand that if they don't get cleaned up, that their skin's going to break down, that they might get bed sores, that they're going to be more prone to infections. If they can't understand what's going to happen if they're refusing something, then actually it's not up to the patient at that point. We can still actually do care for them even if they're not wanting it. It's going to be up to whoever their guardian is, whether it be a family member or a state-appointed guardian. And I can assure you they're going to want their loved one cleaned up. Residents have the right for privacy and confidentiality. Just like in a hospital, people have that right in a nursing home as well. And you need to be careful with this. If we assign you a patient in the nursing home and you know that person, they're your neighbor, they're related somehow, you need to make sure you tell your clinical instructor and we will assign you to someone else. And we're not going to want you to be going in there and giving care. If you're taking care of someone and let's say you hear about a famous person who's over on the other wing and you want to see what's going on with them and check their chart, you don't have the right to be in their chart. People have the right to privacy and confidentiality, and you only have the right to information about that person if it's necessary for the care that you're giving them. So if you're caring for that patient, then yes, you may need to get in that chart. You may need to know how they walk, how they move, what their activity level is, when they had a bowel movement last, how they've been eating. That's going to be important for you to know, but you don't need to know that information on every patient in a facility, only the patients you're caring for. Residents have the right for personal choice. And I think this is one area that sometimes we get really lax on in a nursing home. So again, if somebody came into your house and they told you, oh, we're going to get you dressed now, we're going to do this to you now, we're going to do that to you now, you would be really upset. People want choices, and there's so many things that are kind of taken. Patients lose so much autonomy in a nursing home. We try to give them as much as we possibly can. And so it's important to give them as many choices as you can. What do you want to wear today? When do you want to get cleaned up? When would you like to do this? Would you like to go to activities? You need to give them choices as much as you possibly can. Residents have the right to voice grievances without the fear of reprisal for it. So a person should be able to complain all they want, even if it's not warranted. They have the right to complain and be heard about it. And so without being afraid that their care is going to get even worse. And it's really sad, but a lot of the patients in nursing homes, they're like, oh, I don't want to complain about so and so because then I'll never get good care. Or I'm afraid to complain about this because then they'll really treat me poorly. So, but people have the right to voice grievances without any fear of any retaliation. A resident has a right not to work. Now, some of the facilities we go to, they have gardens and they're really lovely. They'll have like vegetable gardens or flower gardens. And some of the residents love to go out and help pick weeds or help pick the fruits and vegetables. And that's great if they want to. But you can never make a person work for the care that they're getting. Okay. They get good care and they're never made to work. So just always keep that in mind. And facilities are required by that OBRA law to provide activities, group activities. They want people to be social. People do better. We're social people. Okay. And they do better when they can interact with others and get involved with things and be around other people. So we try to encourage people to get involved in activities. Again, they have personal choice. They don't have to do this, but it is something we try to encourage for them. But again, but nursing homes are actually required to provide a variety of different activities to meet a variety of residents' needs. Other things that we try to do is personal items. We don't want people to keep things of high value in the nursing home if we can help it. Just because things get lost, even though we try not to, we try to be careful with their personal items, things can get lost. But we do actually encourage them to bring in, just comfortable knickknacks, pictures, stuffed animals, anything that makes it feel more like home to them. So a favorite blanket, a quilt. People have right to be free from abuse and mistreatment and neglect, and we will be talking about that in a lot of detail as we go through this class. They have the right to be free from restraint. Now, most of the nursing homes that we go to, they really don't use restraints. It's very rare to see a restraint in a nursing home. It used to be that if we restrained somebody, we thought we were helping them. For instance, I remember when I first became a nurse, somebody would climb out of bed. We'd tell them not to. They'd try to climb out of bed again. We'd tie them in bed. We thought we were keeping them safer. But people are Houdinis with these restraints, and they get tangled up in them, and they choke themselves, and they get more aggressive, and they get more combative and agitated. And it really doesn't make your life easier to have a patient in restraint, and it's very bad for them. So they try very hard not to put people in restraints. Residents have the right for good quality of life. Okay, we need to make their quality of life the best that we can while they're staying at that facility. And they have the right to a safe, clean environment. Everybody has the right to feel safe when they're wherever they're living. So the Ombudsman program is required by law. It's OBRA law. It's required. And Ombudsman is, and we'll talk about them in more detail, they are a facilitator of residents' rights. And the Ombudsman, there will actually be a poster posted up at the facility. Your ombudsman is so-and-so. Here's how you contact them. And if anybody feels that the residents' rights have been neglected in some way, anybody can complain. You as a student can contact the ombudsman if you feel the residents' rights have been compromised. The resident can call, the resident's family, any nurse, anybody at that facility can call them. And by law, nursing homes are required to have ombudsmen. So we're going to take a little break here,